The traditional blood work that your doctor orders for you, maybe twice a year if you're lucky, is as close to worthless as you can get, and it's keeping you sick and ignorant. Almost 80% of Americans are overweight, and our relative guidelines for what's normal on these labs don't mean that you're inherently healthy or optimal. So if you're someone who wants to be more proactive with their health and take a look under the hood that's beyond the surface level, here's 10 markers that you should look for to ensure that you're actually healthy. The first marker you should be looking for is fasting insulin. From there, moving on to cardiac risk, the biggest single indicator that you can look at is ApoB, because that's dictating total particle size, so that it has the most direct correlation with atherogenic risk, or the amount of particles in your bloodstream that could cause plaque formation. But beyond that, we also want to look at triglycerides and HDL. Next marker we're going to look at is for systemic inflammation. On the sex hormone side, especially for a man, we kind of have to lump some things in together. On the thyroid side, kind of the same thing. One that's generally overlooked is ferritin, because it's dictating our iron metabolism, basically how well we're oxygenating our tissues and recycling iron or storing it, and this is also a huge indicator of overall oxidative stress if it's too high. If you want to know how your liver's actually functioning, you can't just look at things like AST and ALT in isolation, because without the context we need, they're basically meaningless. But if you want to actually see how your kidneys are operating, you need to look at cystatin C. Lastly, we should also be looking at things like vitamin D, especially 25-OH, because this is not just looking at vitamin D synthesis. We've got to stop letting the system fail us. The fact that you weren't provided with this information, it's not your fault, but it is now your responsibility. So take advantage of it and actually be proactive and be your own biggest self-advocate, because no one's coming to save you and no one's going to take care of your health but you.